Breaking news, the dish disease is on the rise. But what actually is the dish disease? And what if it didn't actually come from dishes?
What's up, everyone? You might be wondering what exactly is a dish disease. I can assure you that it's not exactly what you think it is, because the word dish and dish disease is actually an acronym for the actual name of the disease. The actual name of the disease is diffuse idiopathic skeletal hyperostosis. This is a type of arthritis that affects soft tissues. I made a presentation over this, so let's go check it out. So here's my presentation on diffuse idiopathic skeletal hyperostosis. So first, let's break the name down. Diffuse means it can happen anywhere along the skeletal system. Idiopathic means the primary cause is unknown. Skeletal means it can happen along the skeletal systems, and hyperostosis means it deals with excessive bone growth. Once you understand what this disease actually is by its name, you can realize that it doesn't come from dishes, it comes from your body. Now, if you look at the picture on the right, you can see how the bone is merging and growing into the soft tissue left of the bone. So, what's an overview of the disc disease? Well, it's excessive bone growth, which is its primary thing that it does. This causes abnormal bone growth into soft tissues. It can affect various parts of the skeletal system, primarily the spine. It causes stiffening and hardness of ligaments and joints, and another name for this disease is Forrester's disease. Now let's take a look at the stats of this disease. There's a 40% increased risk for individuals over 50 years old. This disease is 2 times more prevalent in males than female, and this disease affects 10% of the general population. Taking a look at the picture on the right, you can see the different stages of this disease. At stage 0, you can see how the bone is normal. At stage 1, you can see how the bone starts to go outward or inward. At stage 2, you can see the bone almost connecting to each other, but not yet connecting. And then at stage 3, you can see how the bone connects. And this is, if you imagine soft tissue left of the bone in stage 3, you can see how it grows into the soft tissue. Now, what are the causes of the disc disease? Because idiopathic is in its name, the primary cause of diffuse idiopathic skeletal hyperostosis is unknown, but we have several speculations of what the next causes could be. These causes include metabolic factors, genetic predisposition, and hormonal growth factors. And what are the symptoms of the disc disease? Symptoms of the disc disease include back and neck pain, gradual loss of range of motion, but remember that this disease is not just back pain. Other symptoms include pain in joints like in shoulders and knees. Other severe symptoms include numbness from pinched nerves, dysphagia and throat cases. Dysphagia is difficulty swallowing. And in the most extreme cases, you could have neck compression, spinal fractures, and spinal cord compression. Notice how in the extreme cases, the disease deals with this area right here. I don't know if you can see, because that's a really important area to the body. Now, if you take a look at the symptom slide on this presentation, you can see the picture on the right. By looking at part A of the picture, you can see abnormal bone growth where the arrow is pointed, but it looks better than image B. And then what happens in B is that the bone growth at the bottom arrow, the bone merged together, and then at the top arrow you can see a little gap, and that's like what it was, I believe. So this is what could happen to your spine if you have the disc disease. Now, how do you diagnose and manage the disc disease? Since this is chronic disease, and there is no immediate treatment since the primary cause of this disease is unknown. We can only have preventions and management. But first, you have to diagnose it, and you do this through x rays, CT scans, and ultrasounds, but you can also do this through MRI scans. Now, if you take a look at last month's disease of the month, which is nephrogenic systemic fibrosis, you can know why going through too many MRI scans can give you that disease. Now, to manage the dish disease, you can go through exercise, heat therapy, blood sugar control, and pain relievers. There's also one additional management that will be said on the next slide. Now, what are some interesting facts about the disc disease? It's not just back pain, which is what many people believe. It's not just back pain because it can affect almost any part of your skeletal body. And then the most interesting fact about this disease is that unlike many forms of arthritis, this doesn't involve inflammation, which makes it different from the rest. Now, just like the previous slide, weight management is a way to prevent the dish disease for some individuals. Now, these are my sources. Be sure to go check them out. Well, I hope you learned a lot more about the dish disease and what diffuse idiopathic skeletal hyperostosis actually is and what it is not. Go click the subscribe button and also the like button. And also check out this video and this video. Thanks for watching. See you later.